behavioral health has always been a part of what we do, but certainly we're much more intentional with how we do that. We are embedded in the medical clinic.
Dr. Morris has always said that 50% of the reasons people come to a family practice is because they hurt, but it's their heart that's breaking.
We're seeing a lot of depression and anxiety, stress, grief. Our patients have had losses just like we have all had losses. And so many of those things we were seeing before the pandemic, but certainly at an increased level, I think.
Sometimes a patient might be talking to a health coach about their diabetes and they don't know that we have a counseling center. And so they hear that they've been struggling with depression over their diabetes, which is I think that's kind of a common, those things are often connected. And she can say, well, we've got that help too.
I believe that there are a lot of advantages to telehealth. I see some people for counseling, and I thought that I would hate it, and I don't hate it. I think there's a lot of advantages to our patients that I think there were barriers before. Could be transportation. It could be having to take time off of work to come to crosstown.
We have one story of a patient who was in a food line, and it was time for her to have her psychiatry appointment. And she called our nurse Rose to cancel her appointment because she didn't want to get out of the line. But the fact of the matter is her appointment was going to take place on her phone. And so she had her psychiatry appointment while she was in line at a food line. And those kind of things can happen now.
Telehealth does make it a bit easier. I believe it creates enough of a barrier for our patients to where they feel a little safer and maybe open up more quickly than they normally would in person. And then with the barriers that it's reducing for them, they can do it. I mean, we certainly want them to do it in a confidential space. But I have one example of a teacher who used her planning period to do a session. I have another example who she would take her lunch break and go to her car and do a session. So it makes it much easier, I think, for our patients.
Now, to be clear, our patients do suffer from, the digital divide kinds of issues. And so when we say telehealth, there are times that we're doing that with a telephone. And I really do hope that when the pandemic ends, because there's a lot of things that are allowing us to use telephones and telehealth that weren't available, that I'm hoping they'll keep in place, because it really will work well for our patients going forward to have these options as well as the in-person option.
Our patient population, they are incredibly resilient. Many of them have experienced trauma. They've been through a lot in their lifetime, aside from the pandemic. And I'm just amazed every day at the resilience they have, that they are able to even function and do the things that they're able to do with what they've been through.
In the middle of the pandemic, one of our behavioral health consultants was talking to a woman that had lost 3 sisters in the span of a month to COVID-19. And I mean, I don't know how you recover from that, but and so I get really, really proud that we're able to provide that lady help, and for free or at a very affordable price for her. Our visits, from the time when Denise and I first started working together, our visits right now are doubled. Our visits have, for the most part, we have had record encounters with patients since we reopened our clinic in May, early June. If you look at the total number of visits that we're providing, it's been a number of consecutive months of highest visits we've ever had. So just a lot of utilization. And I think that's one, because there's a lot more need out there. We hit the pandemic wall. But I think it's also, in part, I have to give credit some to telehealth, just because it's efficient. If you're, people don't always have their car, but they always have their phone.